Hello everyone, I am Dr. Sarita Jain, an obstetrician, gynecologist and infertility consultant. In today's video, I'll be speaking on subchorionic hemorrhage. Subchorionic hemorrhage is also known as subchorionic hematoma or subchorionic bleeding. This is the condition when blood accumulates between the wall of the uterus and the chorionic membrane during the pregnancy. Chorionic membrane is the outermost layer of that separates the baby's amniotic sac from the uterine wall. This condition often associated with the vaginal bleeding. If we talk about its prevalence, this is the most common cause of the vaginal bleeding in patients 10 to 20 weeks of the gestational age, and it almost accounts for the 11% cases of the vaginal bleeding. Vaginal bleeding is the most common symptom of the subchorionic hemorrhage, but some patients may be asymptomatic, and this is diagnosed during the routine ultrasound. Etiology of the subchorionic hemorrhage usually remain uncertain, and there is no exact cause for the subchorionic hematoma, but definitely there are some predisposing factors which are, when present, then there will be high chances of the subchorionic hemorrhage. These factors are uterine malformation or uterine irregularities, previous history of recurrent pregnancy loss, any kind of the pelvic infection, if it is IVF pregnancy, and if there is high blood pressure. These are few predisposing factors which are, when present, then there are high chances of the subchorionic hemorrhage. According to some studies, when subchorionic hemorrhage is present in early pregnancy, then there are chances of some adverse outcome. These are hypertensive disorder, placental abruption, and preterm delivery. If we talk about the symptom, vaginal bleeding and pain abdomen are the most common symptom, but few patients may be asymptomatic. Pain abdomen, usually it is patient experience cramping type of the pain or uterine contraction type of the pain. When it comes to evaluation of the subchorionic hemorrhage, when any patient of the reproductive age group comes with the vaginal bleeding and pain abdomen, then we should always do the pregnancy test. Now, when pregnancy test is positive, then we should go for the ultrasound. Ultrasound is the primary imaging of choice to diagnose the various pathologies leading to bleeding in the early pregnancy. In ultrasound, appearance of the subchorionic hemorrhage is hypoechoic or anechoic crescent-shaped area behind the fetal membrane. It may elevate the edge of the placenta. So this is the normal appearance of the subchorionic hemorrhage, but there may be sometimes confusing picture also. When consistency of subchorionic hemorrhage is anechoic, then it may be confused with the amniotic fluid. When it is isoechoic consistency, then it may be mistaken for the myometrium, and when it is hyperechoic, then it may be confused with the placenta. So these are the few confusing conditions. Apart from the pregnancy test and sonography, when bleeding is severe, then we should also do the laboratory test like hemoglobin or hematocrit to assess the degree of anemia, and we also do the coagulation studies to check for the clotting disorders. Now, treatment and management of the subchorionic hemorrhage. Treatment for subchorionic hemorrhage depends on the several factors, including the size of the hematoma, gestational age of the baby, and patient symptoms. Some common treatment approaches are monitoring and observation. When size of hematoma is small, it resolves on its own without any intervention, and regular sonographies are done to follow up the size of the hematoma. Patients are also advised to reduce the strenuous activities such as heavy lifting and exercise. Complete bed rest may be recommended in more severe cases. Patients are also advised to avoid the sexual intercourse to reduce the risk of the further bleeding. In cases of the severe bleeding or significant hematoma size, hospitalization may be necessary for close monitoring and supportive care. In patients with Rh negative blood group, RhD immunoglobulins are given to prevent the Rh isoimmunization, and vaginal progesterone suppositories are also advised in first trimester bleeding, but it is not recommended for routine use as it does not increase the live birth rate. Now, if any patient in the reproductive age group comes with the pain abdomen and bleeding PV, then we should always keep in mind certain condition also which may be mistaken for the subchorionic hemorrhage. So these are the condition we should rule out in patients of the pain abdomen and bleeding PV. These are ectopic pregnancy. This is life threatening condition. It is confirmed by the ultrasound. Other conditions are early pregnancy loss, threatened abortion, implantation bleeding. They may also present with bleeding and pain abdomen, and placenta previa, where placenta partially or completely covers the cervix. This also presents at the vaginal bleeding. One more condition is vasa previa, in which fetal blood vessels cross or run near the internal os. In this condition, blood loss is from the fetal origin. Gestational trophoblastic disease also present as bleeding and pain abdomen. In this condition, there is abnormal proliferation of the trophoblastic tissues. Uterine rupture is also rare but serious complication. In this condition also there is pain abdomen. One more condition is ovarian torsion, where there is severe ischemic pain, and tubo-ovarian abscess is a condition where there is infection involving the fallopian tube and ovary, and this condition also present as pain abdomen and fever. So these are the few conditions which may be mistaken for the subchorionic hemorrhage. Now, prognosis of the subchorionic hemorrhage. It depends on the size of the hematoma, maternal age and gestational age at the diagnosis. So if the size of hematoma is big and it accounts for 25% or more of the gestational sac volume, if location of the hematoma is retroplacental rather than marginal, and if it is diagnosed early in the pregnancy, then chances of adverse outcome are more. Now, complication of the subchorionic hemorrhage. Subchorionic hemorrhage have the high risk of the miscarriage or spontaneous abortion. There is 5-fold or more increased risk of the placental abruption. There are high chances of the preterm delivery and premature rupture of the membrane before term, and there are chances of early and late pregnancy loss, and also subchorionic hemorrhage, if it is diagnosed early in the pregnancy, there is increased risk of the developing hypertension in the third trimester. Now, will the presence of subchorionic hemorrhage affect the mode of the delivery? So, subchorionic hemorrhage diagnosed early does not influence the method of the delivery. And will it have any adverse effect on the pregnancy after the 20 week of the gestation? So in most of the cases, subchorionic hemorrhage, last is the patient awareness. We should always educate the patient about the symptom of the subchorionic hemorrhage. If any patient during the pregnancy has either bleeding PV or pain abdomen, then they should always report into the hospital. So this was all about the subchorionic hemorrhage. If you found this information useful, please like and share the video and subscribe my channel. Thanks for watching.